I will make another figure and I'll show you here. इसको मैं ऐसे करता हूँ कि हम स्क्रीन को शेयर कर लेते हैं, और स्क्रीन को शेयर जब हम करेंगे तो ये ओके. नाउ जस्ट लुक हियर. ठीक है, इस जगह पे देखें. When we are going to give blood, and in blood we can also mention blood products. What are blood products? Can anyone tell me? Blood as well as blood products. Blood products are given sometimes. For example, you may have heard in your life that we give platelets to a patient of dengue. Have you heard? A dengue का patient था, उसका platelet count कम हो गया and we transfuse platelets. Okay, and you may have heard that in COVID, yes, a very famous case. In COVID, there was a treatment regime introduced in the start of the disease, that you used to transfuse plasma from a healed patient to a person who is having a disease. So the antibodies may be transferred from the donor towards the recipient. उसको हम क्या कहते हैं? Plasma. Plasma, and that plasma, remember one thing, plasma cannot be stored at room temperature in a liquid form. It is always to be frozen. Plasma has to be frozen to be stored, and that is known as FFP. Have you heard this word before? FFP.
Yes, sir.
Fresh frozen plasma. Fresh frozen plasma, and it is stored in a frozen form, yet it is melted and transfused. It is not transfused in an ice form, obviously. Cryoprecipitate, it is rich in factor 8. Packed cells, which can have red blood cells or platelets. So all of these things are basically blood and blood products. And they have different indications, for example, thalassemia, hemophilias, blood cancers, and a lot of other things. We give it, and it's definitely not the topic of discussion at the moment. I'm not going to tell you when we will give these solutions. But what will happen is, in this case, this membrane will be functional, the one yellow, which was actually the capillary membrane. And in this case, we will have to divide the extracellular compartment into two parts, interstitium and the plasma. And yet in here, when we will transfuse these things in the plasma, what will happen to the volume of plasma? Anyone? If we will transfuse blood to a patient, what will happen to the volume of blood in that patient?
May increase.
It will increase. It will not may. It will increase. Obviously, yes. Very good. And when it will increase, what will happen to the osmolarity of the plasma? Nothing's gonna change. It will remain the same. Why? Because yes, very good. Because the blood is blood. Obviously, it does not have a different oncotic pressure, and nothing will gonna happen in the interstitial space. Nothing will happen in the intercellular compartment. So the only thing which will be tempered is the volume of plasma will increase. That is all. Nothing else will happen. No osmolarity change and no volume change of any other compartment. And when can we give it? The uses majorly blood loss, trauma, surgery, hemorrhages, bleeding, clotting disorders. Have any patient who requires some clotting factor, any patient who requires plasma, and a lot of cases we can. And when not to give? This is an important question. Remember one thing. एक तो देखें इससे क्या हो रहा है, extracellular space का volume बढ़ रहा है. If the volume of the extracellular space is increasing, obviously of the plasma, we should not give it in hypertension. We should not give it in heart failure. The same thing when we talked about in isotonic solutions and hypertonic solutions. I guess you remember it. Is it clear? Yes. Okay. And now there is one word I've had it here: fluid overload. What do you think? What is it? Fluid overload. Can a person go into fluid overload? Yes, a person can go into fluid overload. And yet what is the scenario? What is the scenario of fluid overload? Dekhen, in a normal person, the kidneys are working very perfectly, and the kidneys know when and how to remove how much amount of water, and when and how not to remove water from the body, definitely if it is needed to be preserved. And yet, in some cases, when the kidney is not functional properly, or the patient is unconscious, and or the person has some severe disease in the body in which the body fluids, the quantity of body fluids, cannot be maintained adequately, there can be a scenario in which the person may have more water in the vessels, and that is known as fluid overload. For an example, just try to understand. There is a person of heart failure, and by definition, heart failure is a situation in which heart is not able to pump adequate blood to the body. And if we just infuse large amounts of blood to that patient, what will happen to the vessels? They will become over distended and the blood pressure will increase. The heart, which is already failing, will worsen. Can you get it? This is typical scenario of fluid overload. And yes, here is one thing. हमारे में से बहुत सारों का बैकग्राउंड देहाती है, बहुत सारे लोग होते हैं जो देहातों से और छोटे इलाकों से बिलोंग करते हैं. एंड आप लोगों ने देखा होगा यार, आज कोई फॉरनर है? इज देयर एनी फॉरनर इन द क्लास? प्लीज टेल मी इन अ यस और नो. मेरी भी जुबान टेढ़ी करवा रहे हो. आई गेस नो, है ना? उर्दू में चलते हैं. ओके, जब एक चीज हमारी सोसाइटी में एक बड़ा कॉमन सा कॉन्सेप्ट है कि जी वो जो थोड़े से लेस एजुकेटेड लोग हैं, जिनको अवेयरनेस इतनी नहीं है, वो कहते हैं जी बस खून की बोतल लगा दो, खून लगवा दो. खून बोतल लगवा के पता नहीं उनको ऐसे लगता है कि जैसे वो कोई मिस्टर अमेरिका या कोई एवेंजर सीरीज का कोई करेक्टर बन जाएंगे. बट एक्चुअली इट इज रॉन्ग. रिमेंबर वन थिंग, blood transfusion is not indicated above 10 grams per deciliter of HB. इससे नीचे डाइंग इमरजेंसी हो तो 8 और बहुत ही ज्यादा मसला हो तो 6, वरना 10 से नीचे 10 grams of hemoglobin per deciliter of blood से नीचे ट्रांसफ्यूजन इंडिकेटेड नहीं है. तो कब नहीं देना कि जब HB जो है 10 से ऊपर है तो आप इस रेड ब्लड सेल्स या ब्लड की ट्रांसफ्यूजन नहीं करेंगे. So this is all which is a concern in the blood section. Now the fifth thing, which is known as plasma expanders. Does any one of you know what is a plasma expander? The name indicates a solution which increases the plasma. Okay, which increases the volume of plasma. Now remember one thing. A plasma expander is a solution which is made up of usually colloids. Yeah, plasma proteins. A proteins based solution है, and a protein based solution is known as a colloidal solution. We have written it here that plasma expanders are colloidal solutions. Example क्या है? एक बड़ी फेमस एग्जांपल है जो हमारी टीम में आती है, वो है हेमैक्सिल या हीमासिल भी इसको कहते हैं. कुछ लोग हेमैक्सिल कहते हैं, कुछ लोग हीमासिल कहते हैं. इसकी एक ट्रिप आपको बाजारों में, ऑपरेशन थिएटर्स में आप आगे जब जाएंगे जिंदगी में तो आपको मिलेगी. और ये इसके अंदर गेम क्या होती है, इसका जो ऑनकोटिक प्रेशर है, व्हाट इज ऑनकोटिक प्रेशर? द कोलॉइड ऑस्मोटिक प्रेशर, which is obviously the pressure generated by the proteins in the blood. It is more than the pressure of the blood. So just imagine it here. Just ignore these lines, just focus in this space. What is this space? ये कौन सा space है? What is this space?
Plasma.
This is the plasma, yes. Okay, we will give this solution in the plasma. What will happen here is that the volume of the plasma will increase. ठीक? And yet the osmotic pressure or the colloid oncotic pressure, here it is written osmolarity but it is labeled wrongly. इधर कौन सा pressure होना चाहिए? Oncotic pressure, because now we are talking about the proteins as well. So this pressure will obviously increase because we have given a solution which has a colloid osmotic pressure more than the blood. Now what will happen? This increased oncotic pressure will pull water here. Should it be like that? इम्तियाज बेटे आपका माइक. ठीक है. Now the water will be pulled from this side to this side here, ऐसे. And when only water will be pulled, what will happen? The osmolarity of this area will obviously increase, क्योंकि इसमें से सिर्फ पानी निकल के बाहर के. जब इधर की osmolarity बढ़ जाएगी, अब ये कौन सी जगह? इंटरस्टिशियम. अब जब इंटरस्टिशियम की osmolarity बढ़ जाएगी, यहाँ से मजीद पानी खींचा जाएगा इधर, और जब इधर से मजीद सिर्फ पानी निकलेगा, इसकी osmolarity क्या हो जाएगी? Increase. So there are 6 arrows. First of all, what's gonna happen is the volume and osmolarity of this compartment increases. This increased osmolarity pulls water from the interstitium into the plasma. When only water is pulled, the osmolarity behind in the plasma will increase. And when again here, if the osmolarity is increased, what will happen? That the water will move from the intracellular space towards the interstitium, and again the osmolarity of the interstitium will be raised. ठीक है बेटे, क्लियर है बात? Any confusion? हाँ जी बेटा. Anyone? Quick confusion? Nothing. Okay. So now when can it be used? अब हमारे यहाँ मसला क्या होता है? You know what है जो करा है प्रेसिपिटेट पे जाता हूँ. गूगल कर लेना. क्रायो, it is CRYO. YO is missing. अच्छा अब देखो मैं एक बात सुनो. Whenever a patient comes in the emergency, the attendants are very much concerned कि सर हमारे मरीज को यूं देखें वो देखें, सिफारिशें करेंगे. And many times in surgery we need extra amount of blood for the patient. Obviously the patient may be bleeding, he may have surgery, and we ask them to donate blood. So we need 2 pints of blood or 4 pints of blood. You can just give us some blood, we need it for the patient. And at that very moment everyone will just flee from the picture. वो भाग जाएंगे सारे. जो जी मैं तो बचपन में गिरा था, मेरा एक्सीडेंट हुआ था, मेरी टांग का फ्रैक्चर हुआ था जब मैं 10 साल का था, तो मैं ब्लड नहीं दे सकता. मतलब इस तरह के बहाने करेंगे. And yet in many cases as a whole our country, हमारे पास ब्लड बैंक्स नहीं है, ब्लड का बैकअप नहीं होता. पढ़ी लिखी और बाशूर सोसाइटियों में तो बैकअप ब्लड अवेलेबल होता है, हमारे यहाँ डोनर्स ही नहीं है. बड़ी मुश्किल हो जाती है ब्लड अरेंज करने में, या सिचुएशंस कई दफ़ा ऐसी ड्रास्टिक बन जाती हैं, बात उलट गई, 30 मरीज इकट्ठे आ गए, कहीं फायरिंग हो गई, 10-12 मरीज इकट्ठे आ गए, और डेफिनेटली हमारे पास ब्लड नहीं होता, लेकिन पेशेंट का ब्लड प्रेशर फॉल कर रहा है. और वो जो रिजर्व में हमारे पास जहाँ पे 28 लीटर्स ब्लड पड़ा था, फ्लूइड पड़ा था, उसमें से हम 1-2 लीटर फ्लूइड को लेके इस तरफ शिफ्ट कर सकते हैं, जिसकी वजह से क्या होगा, एक्स्ट्रा सेलुलर फ्लूइड में से भी स्पेसिफिकली प्लाज्मा का वॉल्यूम बढ़ जाएगा और पेशेंट सर्कुलेटरी शॉक में नहीं जाएगा. सर्कुलेटरी शॉक व्हेन द ब्लड volume is decreased, जिसे हम hypovolemic shock कहते हैं. Very precisely hypovolemia. When the blood volume is decreased, तो क्या होगा, पेशेंट hypovolemia में जाता है, decreased volume में जाता है, तो उसमें नहीं जाएगा, और हम ब्लड की जगह ये फ्लूइड दे के उसका इंटरस्टिशियम का उसके प्लाज्मा का वॉल्यूम बढ़ा देंगे, जिसकी वजह से पेशेंट फॉर दैट वेरी टाइम सर्वाइव कर जाएगा. हम बाद में फिर ब्लड अरेंज करके उसको दे सकते हैं. सो आई गेस इट इज क्लियर. किसी का कोई कंफ्यूजन है यहाँ तक तो मुझसे पूछ लें, मैं फिर अगला टॉपिक शुरू करूँ. जी बेटा.